Preparing for a cardiac procedure such as angiography, angioplasty, valve repair, or bypass surgery can be a deeply emotional experience for many patients, and while much attention is often given to medications, laboratory tests, imaging studies, and physical readiness, an equally important but frequently overlooked factor is the powerful influence of emotional triggers on blood pressure levels before the procedure even begins, because the human cardiovascular system is closely connected to the brain's emotional processing centers, meaning that subtle feelings of anxiety, uncertainty, fear, anticipation, or even suppressed stress can activate physiological responses that cause blood pressure to rise significantly even when a patient is otherwise medically stable. And understanding these emotional triggers is crucial because sudden elevations in blood pressure before cardiac procedures can complicate surgical preparation, delay procedures, or increase the strain placed on the heart during an already sensitive time, which is why doctors often observe that some patients who normally maintain stable blood pressure readings at home experience unexpected spikes when they arrive at the hospital or begin thinking seriously about the upcoming intervention, a phenomenon that is sometimes described as situational hypertension or anxiety-induced blood pressure elevation. And this response is driven largely by the body's natural stress reaction known as the sympathetic nervous system activation, where the brain perceives a potential threat or stressful situation and releases stress hormones such as adrenaline and cortisol into the bloodstream, causing the heart to beat faster, blood vessels to constrict, and blood pressure to rise in preparation for a perceived challenge, a mechanism that evolved to help humans respond quickly to danger but which in modern medical settings can be triggered simply by thoughts, worries, or unfamiliar environments. One of the most common emotional triggers before cardiac procedures is anticipatory anxiety, which occurs when patients repeatedly imagine the upcoming procedure, worry about potential complications, or fear the unknown aspects of surgery, and this mental rehearsal of stressful possibilities can keep the body in a heightened state of alertness long before the procedure actually takes place, leading to elevated blood pressure levels even during routine preoperative checks. Another subtle but powerful trigger is the hospital environment itself, because hospitals often represent places associated with illness, vulnerability, and loss of control, and for many patients the sights, sounds, and smells of medical settings can subconsciously activate stress responses, particularly when they see monitoring equipment, hear medical discussions, or observe other patients undergoing treatment, which can reinforce feelings of uncertainty and cause blood pressure to rise even when the patient is not consciously feeling extremely anxious. Sleep disruption is another important factor that can amplify emotional triggers before cardiac procedures, because many patients sleep poorly in the days leading up to surgery due to worry, altered routines, or medication changes, and insufficient sleep can increase stress hormone levels, reduce emotional resilience, and make the body more sensitive to anxiety, all of which can contribute to temporary blood pressure elevation. Similarly, the fear of pain or discomfort during or after the procedure can act as a psychological trigger, even though modern cardiac procedures are typically performed with advanced anesthesia, pain management strategies, and highly skilled medical teams. Patients who imagine severe discomfort may unintentionally activate stress responses that raise their heart rate and blood pressure. Concerns about recovery, lifestyle changes, financial implications, or the impact of surgery on family responsibilities can also contribute to emotional tension before cardiac interventions, and these concerns often remain unspoken because patients may hesitate to discuss them openly with healthcare providers, which means the emotional burden continues to build internally. Another subtle emotional trigger involves the feeling of loss of control, since undergoing a medical procedure requires trusting a team of professionals and temporarily surrendering personal autonomy, something that can be psychologically challenging for individuals who are accustomed to maintaining strong control over their daily lives. And this sense of vulnerability can activate stress responses even when patients intellectually understand that the procedure is necessary and beneficial. It is also important to recognize that family members and loved ones can unintentionally contribute to emotional stress before cardiac procedures. Not because they intend to cause worry, but because their visible concern, repeated questions, or expressions of fear may reinforce the patient's own anxieties, creating a feedback loop of emotional tension that elevates stress hormones and blood pressure levels. Fortunately, there are many effective strategies that patients can use to identify and manage these emotional triggers before their cardiac procedure, and one of the most important steps is awareness. Because simply recognizing that emotional stress can influence blood pressure allows patients to take proactive measures to calm their nervous system. Techniques such as slow deep breathing, guided relaxation, meditation, and mindfulness exercises can activate the parasympathetic nervous system, which counteracts the stress response and helps lower heart rate and blood pressure naturally. Maintaining open communication with the healthcare team is equally valuable, as doctors and nurses can provide reassurance, clarify procedural details, and address misconceptions that may be fueling anxiety. And many hospitals now encourage preoperative counseling sessions, where patients can discuss their concerns and receive clear explanations about what to expect before, during, and after the procedure. Engaging in light physical activity such as gentle walking or stretching during the days leading up to surgery can also help release tension and improve sleep quality, provided that such activities are approved by the patient's doctor. Maintaining regular medication schedules and avoiding stimulants such as excessive caffeine can further help stabilize blood pressure during this sensitive period. Spending time with supportive family members, engaging in calming activities such as reading or listening to music, and focusing on positive recovery outcomes rather than worst-case scenarios can gradually shift the mind toward a more balanced emotional state. Some patients also benefit from structured cardiac rehabilitation, education programs, or psychological counseling that teaches coping strategies for managing medical anxiety, which can be particularly helpful for individuals with a history of hypertension or stress-related blood pressure fluctuations. Ultimately, it is important for patients to remember that experiencing emotional stress before a cardiac procedure is completely normal and does not indicate weakness or lack of resilience. Rather, it reflects the body's natural response to uncertainty and change. And by acknowledging these emotional triggers and taking deliberate steps to manage them, patients can help stabilize their blood pressure, support their heart's readiness for the procedure, and approach the surgical experience with greater confidence and calmness, reinforcing the idea that successful cardiac care involves not only treating the physical heart but also supporting the emotional well-being that plays such a vital role in cardiovascular health and recovery.